Yo, what up, YouTube? Before we start the video, make sure you like and subscribe. We about to get into this Johnson & Johnson recall for the vaccine for the COVID-19. First, comment below if you got it or if you plan on getting it. I'm not saying don't get it, but make sure you watch this before you start to get it. First off, what I think, Corona really ain't that serious as people make it sound. It's just like getting the flu. People that are dying are either real young or real old or sick, got diabetes, but everybody else pretty much survives. It has like what 99% chance of survival. So let's see what they're saying.
The CDC and FDA just released a joint statement. I was reading it now that is calling for a pause, an immediate pause in the use of the Johnson & Johnson single-dose coronavirus vaccine. This is after 6 recipients in the United States developed a rare disorder involving blood clots within about 2 weeks of the vaccination. Joining us now is Dr. Carlos Del Rio. He's the Executive Associate Dean at Emory University School of Medicine at Grady Health System. This is these adverse side effects, a rare blood clotting in 6 women, by the way, ages 18 to 48. Women? 18 to 48, 6 women out of 6.8 million doses administered, Dr. Del Rio. So what's your takeaway here?
Well, thank you, John. I think the first takeaway is that it's a very rare event. I mean, you're talking about 1 per million. And when you give millions of doses of vaccines, you will see events like this that you couldn't see in the clinical.
Well, hold on. If you look, it say 31 million cases of the pandemic in America. 500,000 have died. And I guarantee that's mainly older people or people with sicknesses. So that's one thing I always look at. Why would I get vaccinated if there's really a high chance I survive it? And 189 million got the vaccine already?
Just because, you didn't have millions of people enrolled. So it probably is related. It's rare. But I want to congratulate the CDC and the FDA for very quickly jumping on it, halting the vaccinations until we know more, and really trying to understand what's going on. I think vaccine safety has always been a priority, and I think this is exactly the right move until we understand what's going on and what's the way forward.
I have a lot of friends who have gotten this vaccine, so I think anyone who has gotten it in the past few weeks want to know what to look out for. Here's what the FDA says. People who've gotten this vaccine in the past few weeks who develop a severe headache, abdominal pain, leg pain, or shortness of breath within 3 weeks after vaccination should contact their healthcare provider. That's what they should do. Does this, though, show, Doctor, causality, right? That's the big question. Is it coincidence or causality, or do they not know yet?
I don't think we know yet. What we know, and we need to understand this further, but we know, for example, there's data coming out primarily from Europe in the AstraZeneca vaccine, which is also a adenovirus vector vaccine, so it may be related to the vector. The adenovirus vector vaccine may have something to do with it.
What does that mean for people? I don't put that in layman's speak for us.
Well, let me put it in very simple terms. What it means is that certain types of vaccines, such as the AstraZeneca and the Johnson & Johnson, which use a cold inactivated virus to deliver the spike protein, may be precipitating in very few rare individuals the development of antibodies against the platelet factor 4, which causes this immune thrombocytopenia and thrombosis. So what it means to people at this point in time
Johnson
is I think you're likely going to be okay. I mean, when you think about a 1 in a million event, that's, you cross the street every day, you have a much higher chance of getting run over by a car. So I think what people need to be is don't freak out. I'll be going on in my life, but I would be very attuned to my body. And if I develop shortness of breath, if I develop leg pain, if I develop a headache, and I'm within 2 to 3 weeks of having had the Johnson & Johnson vaccine, I would immediately notify my healthcare provider.
Just so people get a sense of the numbers again, 6.8 million doses of the Johnson & Johnson vaccine have been administered in the U.S. so far. You can see on your screen right next to Dr. Del Rio, that's out of about 190 million doses administered total. So more than 180 million doses that have been administered in the United States have been either Pfizer or Moderna, right? Johnson & Johnson is a very small number of this. So Dr. Del Rio, are you concerned at all, though, that people are going to see this and say, well, I've been nervous about getting a vaccine. This justifies my anxiety?
Well, I think, the concern about any side effects is that it would likely as you say, potentially increase vaccine hesitancy. But again, I want to emphasize that the risk-benefit ratio is way in favor of benefit. These vaccines have saved thousands of lives already. We've seen mortality in the U.S. continue to decline despite cases going up, and that's because we're vaccinating people. So the chances, I would still recommend people get vaccinated. I would not say do not get vaccinated just because of this very side effect.
Really catching it no more.
I would say that it's the right thing to do for the CDC and the FDA to halt the vaccinations with the J&J vaccine until we understand further what's going on and until we understand, as Poppy asked, is this just a causality or is this actually causality?
John rightly pointed out something that struck me right away. They're all women, 6 women, and they're young.
So, man, you are
of 18
you good.
And 48. One woman died, and a second woman has been hospitalized in critical condition. Is, again, coincidence, or why would it be women that are having this impact, and young women?
Well, that's a very good question, and I think it's a question that experts in coagulation are definitely working hard to try to answer. We know women, for example, have more thrombosis when they're smokers, when, we know with birth control pills and hormone replacement, women tend to have more thrombosis. So again, there may be a hypercoagulable, issue related to hormone levels and estrogens. But what the European regulators have done, again, not with the Johnson & Johnson, but with the AstraZeneca vaccine, where a very similar thing was found. Young people, usually women, having the similar side effect, they have recommended the vaccine be used only in people over the age of 60. In some countries over the age of 50, most countries over the age of 60. It may be very well that we say
that's really who should be taking it, or older people,
younger people that have the side effect.
All right, Dr. Lorio, stand by.
Older people should be the ones really taking it. And I'll probably say like kids and babies, but because if you like 20s and 30s, even 40s, like your chance of getting it and dying, like what's the percentage?
For a moment, if you will. We just got word that the FDA is going to hold a news conference at 10 a.m. There are a lot of questions that people have. Hopefully, the FDA will be as transparent as possible and make clear why they've made this decision. Also with us now, CNN Chief Medical Correspondent Dr. Sanjay Gupta. Sanjay, this is big news. It's one of the 3 vaccines, albeit the one that has the least numbers in terms of people getting it, but it's one of the 3 approved vaccines in the United States. People are watching this very carefully. Your take on it, and what does this do overall to the Biden administration's goal of getting 200 million doses in people's arms by the end of this month?
Well, as far as the second part goes, if you look at some of the models and the way that the administration was sort of calculating how they would get to these numbers, it was largely based on the Pfizer vaccines and the Moderna vaccines, which are 2-dose vaccines. So, obviously this will have some impact. But, because J&J came later, because they didn't hit their initial goals, the impact is probably going to be a little bit blunted here. So I guess that's the good news. But the bad news is they've this is, I think every time we hear a report like this, people who are sort of on the fence a little bit about vaccine and, whether or not I should get it, they're a little hesitant. This fuels that to some extent. And on one hand, people look at this and they say, this is evidence of the post-vaccine monitoring system sort of working.
All right, well, we're going to cut this because they're pretty much going around in circles. Do what the hell you want to do. If you want to get the vaccine, go get it. 9 times out of 10, or 9.8 or 9.9%, or chance out of 10, you won't get nothing. You'll be good. If you don't get it, you're still going to be healthy. Nothing's going to happen to you. Just do you. That's all you could do now. Is just do what you got to do to be happy.